In the podcast episode of dentistry, I think I had shared my personal experience
Okay.
of tooth pain. I think the BP fluctuations taken and the delivery complications which took place later. So I can proudly say that in spite of the delivery complication, the cesarean delivery was in magical hands of Dr. Samir Pradhan. So as well said, God cannot be everywhere, so he sends doctors in our lives. We are blessed to have Dr. Samir in our lives. So Lalit, Atharva and myself are really blessed. So Dr. Samir, do you want to share with our viewers what is the impact typically BP fluctuations could have on the patients and how to deal with that?
Yeah. Thank you, Seema, for these kind words. As obstetricians, I think every doctor will pray that God is with them for each and every delivery. Because delivery is actually a physiological process. The whole aim of antenatal care is to have a healthy mother and a healthy baby at the end of pregnancy. And we are dealing with two lives.
Sure.
But there are certain problems which can occur anytime. So the aim, as I was saying, of obstetric care, the antenatal care, is to maintain the physiology of pregnancy, and that is why we advise them frequent visits.
Right.
We tell them to come every month in the first 7 months, then every 15 days in the next 2 months, and in the last month we tell them to come every week.
Right.
Each time when they come, we check their blood pressure.
Okay.
There are two different reasons of high blood pressure in pregnancy. Sometimes now with the advent of IVF and more elderly people becoming pregnant, they are already having essential hypertension.
Okay.
And they are on tablets, and the commonest tablets which are used are the ARB blockers like telmisartan.
Okay.
So if the patient is already taking these tablets and she's planning a pregnancy, this tablet has to be changed by the treating physician or the cardiologist.
Okay. Okay.
Because ARB blockers and angiotensin inhibitors are contraindicated in pregnancy, they harm the baby.
Okay.
So we shift to something called a labetalol, which is a alpha and beta blocker,
Okay.
or a calcium channel blocker like nifedipine.
Okay.
Now there is certain patients develop de novo hypertension, that is they develop blood pressure after the first 5 months of pregnancy, which is called gestational hypertension.
Okay.
And this gestational hypertension cases can have different complications in pregnancy, so they require special tests. We monitor the liver function tests, the uric acid levels,
Okay.
and they also impact the growth of the baby, so we monitor the baby also.
Okay.
So that we call preeclampsia sometimes. Now your case was a one-off case, means in throughout your whole 9 months when you were showing me, your BP never had gone up.
Right.
Probably that toothache which you mentioned in your previous podcast was just a triggering factor.
Right.
When you came in labor also the blood pressure was normal and suddenly it shot up.
Okay.
So this sudden rise of blood pressure is a big obstetric emergency for us.
Okay.
What it essentially does is during pregnancy there is this baby and the uterus, the baby in the womb, and there is this placenta.
Right.
When this blood pressure rises suddenly, then this placenta can separate prematurely.
Right. Right.
We call it in our medical terms abruptio placenta,
Okay.
and there can be heavy bleeding, which we call antepartum hemorrhage.
Okay.
And this warrants a immediate delivery. Like we have to deliver as soon as possible.
Okay.
If the patient is advanced in labor, we can deliver by instrumental delivery like vacuum or forceps,
Okay.
or we have to take her for a cesarean section.
Okay.
And we have to be prepared that after delivery also there can be excess bleeding, which is called postpartum hemorrhage.
Okay.
The uterus may not contract, and if there is excess blood loss, the patient may have a consumptive coagulopathy where the bleeding is unstoppable.
Okay.
So we have to be prepared in pregnancy trolley where we have all the kits which are there at our disposal.
Sure.
If the pregnancy is the BP keeps on increasing throughout the pregnancy, and there is preeclampsia, very rarely prone for a convulsion, which is called eclampsia.
Sure.
So that eclampsia also has to be managed by a medicine called magnesium sulfate. So we have a kit where we have magnesium sulfate.
Okay.
So these two are the commonest nightmares of every obstetrician: obstetric hemorrhage and eclampsia.
Okay.
That is why it is essential that every woman delivers in a nursing home. In the olden times, there used to be home deliveries. Even in the village, there is this concern that at home delivery, the delivery can be better by dais who are trained.
Right.
But now government has made primary healthcare facilities available. There are district hospitals. Government is putting a lot of efforts in the mother and child welfare. So I think all women in India should visit a primary healthcare center or an obstetrician throughout labor. And the labor has to be monitored, because sometimes inadvertent problems like sudden high BP, as in your case, can occur unexpectedly.
Right.
And as we were taught in our school days in Scout and Guides, the motto of a Scout and Guide is be prepared.
Right.
For an obstetrician, our motto always is be prepared for these two major complications.
Sure.
So that is ensured in an institutional delivery in a hospital.
Okay.
That is the importance.